up, beautiful, gorgeous people? Yes, we are back. This is On the Couch, and of course, yours truly, Enek Drums. And of course, today you might be wondering where we are, Lelo Tulipa Bega Melt, where the good food is served. Yes, and we are back with informative and educative topics, adding the spice on the entertainment that we have been saving you. And with me, I have a special guest, and we are going to be talking about a very special topic that a lot of people, especially young people, feel uncomfortable to talk about in public. But yes, we are bringing it to you so that you feel comfortable to talk about it. With me today is Madam Judith Mutanka. I'm going to allow her to introduce herself. Yes, ma'am, how are you?
I'm good. How are you?
I'm fine. You look lovely.
Thank you. You too.
Thank you. How are you feeling?
I think I'm feeling okay.
Mhm.
It's a good weather, though it's very hot. Yeah.
Just introduce yourself to the audience.
Okay. I'm Judith Mutanka. I'm a nurse manager in charge at Kakolo Rural Health Center under Kitwe District Health Office. Yes.
But to our viewers, today we are going to be discussing a very special topic, which is young people and their reproductive health. Young people and their sexual reproductive health, that is a topic that we are going to be discussing today. Ma'am, to start with, just maybe break down the topic itself. What is like sexual reproductive health?
Okay, thank you very much. So when we talk about sexual reproductive health, we are basically talking about the health that concerns this scale that is also related to sex. What are we looking at? We're looking at hygiene, how somebody's supposed to keep their private parts, for lack of a better term, and also how you're supposed to take care of yourself, how you're supposed to keep yourself healthy in those directions. Not merely keeping yourself safe for that someone out there, but specifically for you as an individual, and be proud of how you are keeping yourself safe. Yeah.
Knowing that the reality about is that even if we say that young people are not engaging in sexual activities, the reality says that, and what we are seeing is that they are engaging in a sexual reproductive, sexual activities.
That's true.
So now, just to start with, maybe what is safe sex itself, so that young people get to understand.
Okay, thank you very much. So when we talk about safe sex, we are saying this is the kind of sex which is protective. What are we trying to protect ourselves from? We're trying to protect from sexually transmitted diseases, and also generally, I think it's about, and also pregnancy. If we go out of the line, but basically it's usually the sexual transmitted diseases, which include HIV, other STIs like gonorrhea, syphilis, and many more, and also the pregnancy itself. Yeah, I think that's what I can say.
So now, growing up, I had this question in my mind. No sexual reproductive health, Shanshani. You take care of Shanshani. This question, and I'm sure there's a girl out there, a boy child. Is there a right age when you have to like engage in sexual activities, or maybe in a sexual relationship?
To say there's a right age, I think it depends with the person, the culture, and their belief. That's what I can say, because we are seeing young people engaging in as early as 15, as early as 14, and they are also giving birth. Others at a later age, or others even as far as 30. So it depends. It all depends on what one believes in, what they feel, or at what age do they feel like they should be, without really being pressured by other people. Although other people, they go in it because of the pressure that comes from friends. When we're growing up, people will be like, what are you waiting for? You're still a virgin. You're waiting for the chicken to come and do something to you, like things like that, and they would make fun of you. But at the end of the day, I think it all has to do with maturity. It all has to do with what you are consenting to, and it has to be an informed decision that is coming from someone who's well vested with the knowledge that is involved in the sex act of the same. Because you need to know the consequences of sex. Why am I engaging in sex at the end of the day? Is it because my friends are telling me to engage in sex, or is it because I want to just experiment, or why am I engaging? So it really has to take someone who's really mature and ready for the consequences that come along with the sex. Yeah.
Well, Kwaliba, like you have said, very pressure to say, if you're in a relationship and that you're not having sex with your boyfriend, that means that
Yeah,
that pressure that comes
that's true.
with it. But a lot of young people don't realize the effects. If it's fumamo, like you said, to say, if I have sex mwala and they don't understand, like you mentioned, Paface, to say there is safe sex.
Yeah.
So maybe just the effects of unsafe sex, because it's something that's normal to young people to do.
Okay, like I earlier mentioned, the effect of sex. There's a pregnancy, one, in a girl child. You might have this child that you are not even prepared for, that you are not even financially capable of taking care of. So there are all those consequences. There's the STIs I talked about. There's gonorrhea. There's syphilis. There's the HIV itself. At times, even pubic lice. For those who are not, hygienically practicing good hygiene. So there are all those consequences. Then, especially in females, it's almost difficult to tell if one has the STI. And most of the time they realize that they do have the STIs, it's usually too late. In a guy, usually 3 to 4 days they are there, because they use the same private part or the same organ for sex and also for urination. And as a result, when one has the STI, they are able to tell within 2-3 days. But for a girl or for a young lady, it's difficult. It will take months, or to some extent even years, when you start now seeing like the after effects of it, or like when you start having a foul smelling discharge and things like that. It might be too late, and the infection can even ascend up to the fallopian tubes, the ovaries, meaning at some point, as a long time term effect, it can even bring about infertility. So if there's even poor communication between the person that you are sleeping with or the person that you're having sexual encounters with, that can happen. And if someone is not even doesn't even have good health seeking behavior, that can be very fatal, especially to a girl. Yeah. So those are some of the effects. Then HIV as well. Yes, HIV now we have come to live with it, but how ready are you as an individual, to stay with such an infection for a very long time? Because once you contract it, it's contracted and that's for life. Then the other thing that I forgot to mention, one of the STIs, we have what we call the Watts. They are viral and they also don't clear off. So the only way you can do those is just by maybe trying to cauterize them. That is using some electrical stuff to like reduce them. Otherwise, you go with those and they just never clear. They just reduce. Yeah.
There's a practice ibalanda tinga or if it's tapo, that's when you get see if yakula, it's like a chakula tapo. But yes, but if you're not exposed to such, you not have that, you not be eager to engage in it. If you look at it, like, what are some of the things that especially young girls should look out for in a man before maybe they engage into, to having sex? Because in Gefia Mulan, they also don't have sexual education. Then I open them love to say no, relationship, yes, what are some of the things that young girls specifically should look out for, especially in these relationships?
Okay. Personally, I feel a girl should get to know who they really are themselves. As a girl, you're supposed to know your boundaries. What are my do's? What are my don'ts? Because even as you are engaging in this relationship, you should ask yourself, why am I engaging in the relationship? Because people are having a boyfriend here and there, and everyone else wants to also have the boyfriend by their side. But what's involved at the end of the day? You're supposed to ask all those questions. What is it that I'm really looking for? Is it love? Because sometimes you find that the love is there at home. But what is it that you're looking for beyond that love? So most of the people, they go into relationship with a notion of experiencing the sex act itself, because they know that obviously when I engage with this guy, definitely something like this will come up. So as a girl, you're supposed to know yourself, know who you are. And at the end of the day, you'll be able to know to say, am I ready for this? Like I've earlier mentioned, consequences. You need to know, if I engage into sex, what happens, and at what age am I? Because let's pick someone who's 15. How many relationships are breaking every day because I engaged with John, then 3 days later the relationship is over, we had sex. Tomorrow it's Gerard, the other day it's Mulenga. You find that by the age 30, how many men would you have
You have
slept
a
with?
body count of 20.
And your body is slowly wearing out, you know. So those are some of the things that girls need to know, to value their own bodies, because it's not every Jim and Jack who should come and enter your pants and everyone, because I'm supposed to show. What love are you trying to show? And sometimes you shouldn't run away from the Bible. The Bible says engaging in sex at when before you are married, it's a sin. So there are those things that we should have at the back of the mind. What does the tradition say? Does the tradition also encourage us to engage in this sexual act? So I think in terms of sex worth, I mean your worth as a human being, I think it shouldn't be like every Jim and Jack that you meet. No. And I remember us growing up in our school days, we had people coming for scripture union where they would even like pray for us, like secondary virginity, which we don't talk about today. The meaning, this person had engaged in sexual activities, but at the end of the day, they realize the consequences, the things that are related with sex, and they decide, no, me, I think this time around I'm going to stay away. So there's also that. But how many people are practicing? Because at the end of the day, women they are usually emotionally attached to a man, and if you keep on being attached to John, to what, at the end of the day, you lose yourself. And these are the people that you find that at the end of the day, they just end up to be sex workers because they feel frustrated, even when a genuine man who loves them come their way to say, I'm interested in you. I want, your hurt, to bring them together so that we start something fresh. They won't be easily trusting because of the past experiences. So I think as girls, we should give ourselves time to analyze the situation, time to know why in a relationship. Because I don't think the relationship just has to be about sex, and all. You need to learn ideas. There are people like who would encourage you to aspire you, pursue education, because you are going out with someone who doesn't even understand anything about education, and you're saying, oh, I want to be this in life. How is that person going to, push your aspirations? So those are some of the things that one should look out. Yes, being in a relationship is healthy, but at the end of the day, you need to know why you are in a relationship and why you want to pursue that relationship.
And you have to look out for the kind of relationship that you are in, if it's healthy itself.
Exactly, exactly. Yeah.
Because most of the times kula bafia ti adi bafia pressure to say adi kalafie umwina isunga, but because of the pressure ile makuba nanko, they're like, no, you can't stay alone. Uringire wakwatako, let's say nika John kachinga nika James wakwatako. And then you find uria James wa msanga. And then James talechitapo understand. Then for a relationship in sex. Takuipishapo like what you want to do. Ulefa tukachange. And then ngawakwate fumu oro akubutuka James. I feel like that's really affecting the young people. They don't understand, and we have a number of teenage pregnancies like you mentioned. Taishibe aisa sanga vya Sky wako na James na Shani, and then wakwate fumu. At the end of the day, ulesa mkuchita realize nisha maybe you're in your early,
it's too late.
Yes, in your early 30s. But no, why did she just ask on the side of things that girls should look out for in a boy before they engage in a relationship? What of on the boy side?
Like I think it's basically about communication for both guys and girls, because even the same guys we're talking about, they're always pressured. Like as the trend is today, everyone wants to be in a relationship with this guy who's able to take them out to better places, buy them nice clothes. I think that's the trend now. Now here is this poor guy who is maybe a student, who can't even afford to pay for their tuition fee. Maybe they're even on bursary. CDF. And there's this girl, because you feel, oh, this girl is just too beautiful, and I need to up my game. How are you upping your game? Because you need to put pressure on yourself, as in study and become a better person. And then now you are shifting your attention to be pleasing this girl. At the end of the day, you're not even going to satisfy her with all the needs, because I mean, this time to satisfy somebody, it's basically about money. But how much money can you have to afford all those things? Because they need to, this time girls want to be showing off on social media. Oh, we went with my whatever at Spur, we went at Garden Court and all that. And if you can't even afford, you take somebody at Hungry Lion and there will be the mockery. Yes, yala and mockery for everyone. So why should you pressure yourself? I think there's time for everything. Time when you know that now I'm ready into relationship, and at the end of the day, you should ask yourself, this relationship that I'm getting into, what do I want to see at the end of it? Or is it that I just want to experience that I had somebody, or maybe it has to end in marriage, or I just want to have the experience? Because those things are supposed to communicate. Maybe it's a study buddy, all those things, and you can't tell me that you can have a study buddy who has got nothing up there, and you sit down to say, oh, this is my study buddy. What are you doing? It's like you have something at the back of your mind and you're just hoping that this thing will turn out, to be better at the end of the day. So even as guys, let's look for people who are productive, who add value to your life, not to pressure you unnecessarily. Because someone who really loves you, a friend, someone who cares about you, would want to see you getting better, not for you to get into now problems. You still first mwamba nokuya kushani kwa God.
Just to pleasing everyone.
Yes, at the end of the day, just to please somebody, and at the end of it, or they even run away to get somebody who's better than you. Believe you me, education is something that is able to balance us up, because in our assembly you get a good job, and sometimes not just about a good job. When you're exposed to education, you are also able to think beyond what you've learned, and you can even start up a business because you understand something fully, and you can even make more money than the people that are formally employed.
I think young people nowadays, we don't understand the importance of having a friend in your boyfriend.
Yeah.
Because if we look at it on a friend perspective, to say, okay, you consider this person is my friend, yes, he's my boyfriend, but he's my friend. Even other things, you will be able to feel free kulanda nanko to say, okay, mwana boy ndefo kushitefia so na so. But nowadays, yaba fia kuchinjanya ni exchange. If I give you money,
Tit for tat.
yes, tit for tat. It's a must. Tababa takuma bana consent these days my relationship. If you're feeling it, I feel like there is need for young people to understand the importance or the value of friendship in relationships.
Friendship is everything, because your friend, you will know when they are not okay. Your friend, you'll be able to tell that, oh, I think my friend wants, this. But at the end of the day, you'll be pressuring somebody because you don't care. It's like at the end of the day, like for the girls' part, all you care about is the money and not really the person as person. We are seeing celebrities this time. We're seeing individuals, when you look, sorry to say, but they're not just merely looking out for things. When there's no money, I don't want to talk. I'm not in the mood.
Yes.
When there's money,
now.
Oh hi, yeah, like that. So we need to have people with genuine friendship, and when you have a friend, indeed, something good will come out. Even the same sex that we are talking about, you'll be able to say, no, my dear, I think I've got this ABCD that I've said before me, and I don't think I'm ready for this. And a true friend who really loves you, they would wait for you. But someone who's just after the sex, they won't even care whether that hurts, or if that is really adding value to you, or if you feel like it's demeaning you. They wouldn't care. Yeah.
I have a friend who says that ngaurimu relationship, then after sex, you have to realize that you guys are not busy.
Yeah.
You're not doing things to make to make money. That's why you're just consistent pali sex. Because it's just for a short period of time, which has a lot of consequences that we don't understand.
Yeah. Like I said, when you're going in a relationship, what do you want to see at the end of it? That's the thing. Because even these people who have sex here, there, once the consequences come on, I'm pregnant. Others even go to the extremes of aborting. Others go to the extremes of dumping that person and move on to the next. And what do they do to the next person? The same things. So it's high time both the guys and the females learn to value themselves. Why should you be undressing to every person that you see around? No, that's why it's called a private part. It's a private part, and it really needs to be private. Yeah.
I think we need to understand, and just for young people to learn to say it's not every relationship that requires for you to, to have sex with the person, because certain people are just not there to stay.
And that's true. That's why we've got so many exes. If people were to be asked how many exes, other people can't even
And the sad part is that you have slept with everyone. And
can you imagine? Even your body just it wears off. Because every time this one comes, this one comes, this one comes. By the time now you're trying to settle
there's a
down.
term oyo betachan marriage.
Yalipwa. Na motoka yako ata mileage ingira chipa.
Let's talk about contraceptives. Let's talk about contraceptives. What are some of the contraceptives that young people can use as they engage in sexual activities? We know that in as much as we can say that okay, we that they engage, they are engaging.
Yeah,
and not everyone is going to abstain to say okay, nena la isunga vimfini. Kaika excitement kadi savings What are some of the contraceptives that young people can use?
Okay, my biggest contraceptive, in my own belief, is abstinence, especially when you are not ready. But for those who feel they are ready to start having sex, whatever, due to their personal reasons, there are what we call the short-term contraceptives. There are also the long-term, and anyway, I can't talk about permanent because we're talking about young people. Yeah. So for the oral contraceptives, we refer them as short-term. And again also have barrier methods, which includes the condoms. Yeah. So the short term, which is the oral, it's very effective, and it has to be taken like on a daily basis. Apart from that one, we also have the emergency contraceptive. That is if you're not on contraceptives, you have unprotected sex, and you want to prevent yourself from getting pregnant. So that one, you take it immediately after having the sexual intercourse or encounter with somebody. You have to take the same tablets. I think there are 2. You take immediately because it's effective within 72 hours. The earlier you take it, the more effective. The lesser the hours, like that.
Actually, the morning after Babantua is in the Panad. And we don't understand the kind of emergencies that they have, but they are quite in Panado. And we have seen a lot of them coming to say, no, Tayawomba, Narino morning after, or Nari Kwatama safe daisy, and then Nalala no more women and morning after, but again, Alisa Sangati.
Exactly.
How does it work so that they understand? Because Kulaba, Bambibare, Shimikano, Narila, Nankomairo, Nanwa, again, Nalala, Nanko Chungulo, and they expect it to still work. How does it work?
Just that you mentioning that means that person didn't even plan for them to even have sex, to engage in sexual acts. They never planned. That's why now they are taking the emergency pill. So the reason why certain people get pregnant, even on the emergency contraceptive, the morning pill, the morning after, morning after, it's because the mode of action for this drug, it's only effective if the egg has not ripened.
If you're not ovulating.
If you are not ovulating, it's very, very effective. But if the egg has already started its journey and you take it, it's somewhere in the fallopian tube, it's been released from the ovaries, and
the sperms are too strong.
You will definitely get pregnant. So it's only effective when you are not ovulating. That's it's able to work. But if you have already ovulated, sorry, it's not going to work.
Like the periods apaku morning after, like I said, Bambale no kwati ni Panado. Like, how is padding the papita months young apaku waisanwa?
No wonder it's called an emergency. So why should it be an emergency every time? It's better for that person to not to just start it's better for that person to just start the normal family planning, which they should be taking every day. Because like I mentioned, it's not effective, and it has got consequences, because every time it's like when you take, you're trying to boost up the progesterone levels within your body system. And at the end of the day, progesterone also it also supports the growth of the pregnancy. So you can't be, like every time having it. Then at the end of the day, you have to ask yourself, why is it that I'm taking the emergency pills every now and then? It means there's something wrong with you, because you need to be planning for what you're doing and the consequences.
Maybe just an emphasis muchiremba kaili I am a pro yaba yaba mweyote. Yes.
Yeah. Yeah. So like I'm a side effect. Yaba fekwati ni any other family planning. Umutwe, you have nausea, like that, all those. So yeah, I think basically that's that.
Can ungodanwa sana morning after, is there a chance that ilesa mukuchita result muri cancer ngawainwa sana? There is a rumor, like people talk about it, but I don't know how true is it.
Okay, so like you've mentioned a very good point. So for cancer, the way cancer comes, although cancer has got no known cause, but there are predisposing factors that are related. And contraceptives, especially the estrogen one, which is not so common here in our part, because usually here we have the combined one, which is estrogen and progesterone, the two hormones. But prolonged use of these contraceptives, it's also one of the risk factors that one can have cancer. Apart from that, if you are having unprotected sex, in a guy, they have the HPV virus, especially those that are not circumcised. So when that HPV virus comes on the guy, it has got no effect. It's like it's something normal. It's like a normal germ on their body and can't cause anything. But when it comes onto a woman, that will be now a source of the what we call cervical cancer. So when that virus is transmitted to this girl, and if maybe this girl smokes, there's a history in the family where they have cancer. Apart from that, maybe they are exposed to certain chemicals and things like that. That's why starting sex at a very tender age, these are the consequences. And being in on and off relationships, where every relationship you are sleeping with someone, because you meet some men that will be circumcised, some men that will not be circumcised, and you are exposing yourself to this cancer, because if you've seen these days, the cancer rates are quite high. So you should ask yourself even about that. Thank you for bringing that up, because I think even this is one of the effects that comes with unprotected sex. So these are some of the things that you should really, really think about. What can I do? What am I going to do? Yeah.
Now let's I have had some, they say katema, it just depends no ko ikarira. Kai us on the copper belt, some will say boy now katema, but if you don't understand, you not realize what they're talking about. Now katema, now kataka ka CD, like the condoms.
So katema is condom?
Yes.
Okay. Some places they call it pregnant. So
kai lichilingire no more
have
they
your
won't
yeah.
Na patai mwa waranzira po, but others will say katema, others will say I'm a rap, others will say I'm a CD. Yeah, it just depends on the person you're interacting with.
Yeah.
The language How effective are they? There are complaints to say especially on the guy side, to say no nari wonfia katema, and then sasa ngatumwa nakasha kwate fumo, I double check. How do they use?
Okay, so condoms, when they are consistently used and correctly used. Correctly. Naughty, the condom is being used and then maybe it bursts along the way and you expect not to impregnate somebody. Yeah. So if it's correctly used, I think it's able to prevent the pregnancy, and it's about 70% safe to prevent somebody from HIV. 70%. Not 90, not 100, 70%. Somewhere there.
How do you need to on the use parts? Common things like people say, young people, they just hear these things but they don't know how to ask. You're using condoms. Like, is it okay for a condom to be used twice?
Twice as in
the same condom to be used twice
at different sessions? No,
yes.
No. Yeah. And most of the time we usually talk about the male condoms, but there are also female condoms. Female condoms, I feel they are more accommodative and they rarely burst because they are quite wide in nature. They are quite wide, and this has to be taken by somebody who's planning to have sex, of course. It can be worn maybe 2 hours before the act, and it just fills up like the room of the private parts, which is the female organ. So it's quite wide. So chances of even like it bursting or what, it's quite slim. Yeah, because it's big. It's really, really big. Unless otherwise.
In as much as we can say, okay, let's be condomizing. They say condoms usually favor the guys, the guy, and nabwaba umebambi baranda 13 days ya sweet kwa village paper. And nabwaba nakashambi, they will be like, inama condoms ya lamba ba I'm allergic 13 days won't fiama condoms. That's why twalitemwa fefia ba raw. If you have a natural, are there side effects of a condom, or maybe it's just a misconception to just because wali umfomo by that I need so
I think it's just a misconception because I think the oils that I use, they are body friendly, maybe to some extremes, because you can't say never. Yeah, and sometimes, like you've rightly put it, certain people, when they just hear somebody, oh, because I did this, even they'll follow. It's
they'll
just
be like
family planning.
compared
Sex is about the mind. It's about the mind. So what you tell your mind is what you're going to experience. So because you've seen it and it's acting as a barrier, something that is going to hinder, and you feel it's not going to be like, it's different. It's just about the mind. Once you're prepared for it, you are, and then you do it. It's just natural. Yeah.
Other sizes on, like, for the female, it's well known on the side of the gent.
On the size of the gent, I think I saw some like in ShopRite. I think they've got sizes depending on how big somebody is. But like the ones that we have in our clinics, I think they just come in one size. Yeah, I think they basically got like the average size of the Zambian man. Yeah. So I think we only have one size for the ones that are given free, especially at the health facilities. But I think in ShopRite and some other outlets, there are those ones that have got size, and also the thickness. There's very thin, what, scented, and just different ones. But us, we just have the ordinary ones.
We're talking about the sexual reproductive health, and usually my young people, they will be like, okay, nabalanda school condomized, like you have emphasized on it, and they will look for other method. Let's talk about the birth control that ladies but let's see how effective is especially ngata wako atapo mwana. What are some of the side effects?
Okay, so the family planning, okay, I like calling it family planning. Okay, it's contraceptives. Yeah, so the contraceptives, they are very effective. However, there are side effects, the undesired effects of these drugs, which is not very common though, but it's there. Infertility, or taking long for one to conceive. Yeah, so there are some that would act like that, especially the injectable ones, and to some extent even the implants. But with the oral ones, it's not so much is pronounced. Yeah, so but it's very safe. One person can use, but maybe just that, because you have it at the end of the mind to say, there's this other thing which can come on, but it's not very common. Yeah, but it's there.
Can they be safe for a young person to use?
Being safe, it is safe, but
the consequences,
like even the bleeding, there's bleeding again, there's what we call amenorrhea, where this person will not be having their menses, and others might mistake it for pregnancy. Although sometimes people feel like when they use family planning, it's going to help them to prevent the pregnancy, which is already there. It doesn't, abort, no, but it just helps to strengthen that pregnancy so that you can deliver safely.
On the side of sex, usually we are hearing nangu, like there are people who are leaking, I've seen videos that are not okay, and young people, they are picking some things from that. And one thing that we have seen that is training is ama oral and annual sex, which I never learned that. I'm a blow job, I'm a head. What's your take about that?
Yeah, I think anything that is not natural, I don't think it's okay. I think in one post, Dr. Mjajati wrote to say anything you touch with gloves, you can't eat it raw like that. Yeah. So apart from that, we mentioned about the HPV that is found in this same guy, and then especially if you are doing the same blowjobs to these guys, that the STIs, you can have gonorrhea. Now imagine in the mouth. And that's why some cancers, especially the throat one, is also related to the HPV virus that is coming from a guy. And sometimes you find someone with dry lips, even if they apply the Vaseline and they are just oh my God, what if he says that's an STI as well. That will show you that someone has been having oral sex. So anything that is not natural, it's not okay. I think the anus has got a lot of blood vessels, meaning the exposure that one can get from having sexual intercourse the natural way for the anal is like, I don't know if it's how many times high, because there are so many blood vessels that will be erupted, and as a result, it increases the chance of one contracting the HIV and also the STIs. And not only that, it also reduces the elasticity. Naturally, the anus, the way God created it, it has elastic. And that's how come even when you have diarrhea, you're able to hold it. Now, elastic. I was privileged to nurse somebody. I think when I just graduated, I think that must have been when I just worked for a year or so in 2007. You can imagine 2007. Somebody came with the anus that had no elastic and was wearing diaper, and he was 19. Now you can imagine someone, the self-image has been tarnished because they can't hold. And as far as fecal matter is concerned, there's that bad stench, the smell and all that. So you can't even have confidence, And then repair. I'm not aware of the repairs that are done here in Zambia, but I think it's a very, very difficult kind of arrangement. So why expose yourself to such? Yeah. So it's really not something that I would want to see anybody, going through. It's really bad because when that guy found me, I think by then I was the youngest, and I think he could relate. So I was like, and it was very strange. I was like, what happened, because it was unheard of way back. Yeah. But this time it's so common. And then these guys, they are just after the money and the people who are offering them all this, but you live alone with your faces at the end of the day. So I really need to.
And the same annual sex has gone to the side of the ladies as well. Like it's a normal thing that they are doing. They use my baby oil, and they are okay with that to say normal. The other thing that they take is that the orgasm is high. Kunuma kuchira kuntanshi. What are some of like the effects kubana kashina bena elastic ilapo nangu bena yali bako
then all of a sudden we want to use it for other things. Sometimes as human beings we are too experimental for no reason. Because even like when we get dogs, I mean animals, you'll never find animals using any other form, to have sexual encounters with their partners. But I don't know what's wrong with us human beings. Everything wants to experiment, and the consequences, most of the people, they don't really come out to say this is what I'm facing, unless a few brave ones. They are the ones that come out to say no, this is bad, and I'm experiencing all this. They just want to show you the better picture. And what is the better picture that everyone is being shown? Money. But what is money when your health can't really hold you? Money is left. Rich people have died, they've left money behind. So we really need to focus on the consequences of some of these things that we engage in. Even the Bible talks about that as a youth you need to be excited and what, but at the end of the day, There will be judgment. So those are some of the things that we should be considering. Yeah.
Does especially young people, do they need extra power for them to engage in sexual activities, or ladies like spices, no mubiri wanzimbike kwefi umubiri uleka bashani, and then to the guys will be like, okay, quite about to drink banwa, and then
The
what are some
sexual
of the
boosters.
consequences?
Yeah.
Eh?
So, like for a lady, most of the time there's herbal insertion, and herbal insertion, those things are also the risk factors to the cancer that we were talking about. And then you are trying to be, I think naturally a woman is warm. I don't want to say hot. They are warm, yeah. But it's just the general belief where you feel, no, me, I'm cold, I need to, and things like that. So everything that we do, it's about consequences at the end of the day. Yeah. Even for the guys, some of the drugs they take, they increase the heart rate. If that body formology, what happens? Especially with elderly ones, when they start taking that, it increases the heart than the normal. And if there are those people even have cardiac problems, or they're even hypertensive, sometimes, especially with the hypertension, people don't even get to know that they are hypertensive, and you're taking those things. And sometimes even take the overdose. So cardiac arrest can just come at any time. It just collapse, and that will be it. And some of them, they've got a long-term effect. That's why I'm also even against these energy drinks that people like taking. Today, you might not know, but I don't know if you've taken them before. Have you noticed that when you take them, it's time to sleep? Your body and everything want to sleep, but your mind is still awake. Why? Because all those effects, you can imagine how you've been taking those for a long time because you want to have this energy, so that you can be seen that, oh, there's a guy here who's making, out with this girl. But at the end of the day, the consequences can be fatal. So that's why those things, they are not encouraged. I think sex is a natural thing that God created, and it can be done even without the boosters, unless someone has got a problem, and the drugs can be prescribed by the doctor or any other health personnel. Yeah.
The money chasers about boom for sex to chase impia. They'll be like, they'll sleep with a man today, then they'll go back kunganda buy kalamuri ice and buy longer ice kunshi, and then at kwabwela olo but the traditional like bape penshi shanshan. What effect does it have on the lady?
It's the same. It's the same, because like every time you're having these bruises, because your body is not ready, you can't be having sex from one person to the other. Your body is not yet ready. So chances of that person, bruising you inside, it's high. Then if those bruises come, it's that healing process that is taking place, which will now, instead of maybe just healing properly, some cells might continue to divide in trying to heal those bruises that are done almost every time. So that's why even the effect of being at risk for cancer, being at risk for sexual intercourse, because even the pricing, I hear even the pricing is higher when someone,
when they marriage.
No, I mean the pricing for the person who's giving the man, the person they're sleeping with. If they're going live, it's higher. They're using a condom, it's less. Cheaper. So, so all those things. I think it's centered on all that we've been talking about, yeah. The STIs, the what, yeah. The pregnancies.
Same with the issue of having multiple sexual partners. What effects or what makes young people engage in multiple sexual partners?
I think I would say, from my own perspective, being selfish. Yeah, being selfish, and at the end of the day, you're going to pay for being selfish. Why a lot of partners? Why? Because maybe it's money, but all that money, is it worth it when you have the diseases that won't be treated at the end of the day? When you finish your education, you are proud with your degrees and whatever, and you find that you've got this serious infection that you can't even enjoy what you worked so hard for. Yeah, it's really a sorry side, because the networking, that man maybe you are sleeping with has got a wife or has got other several girlfriends. Now you can imagine you're just exchanging, and I think it's quite dirty. It's not healthy at all.
The sexual reproductive health is a very long topic.
It
Turela
is.
ndave,
It
namaro
is.
turela ndave. Like in conclusion, like where can young people access the sexual reproductive health services, like the education, not just the contraceptives, but the education and the information that they need?
Yeah, I think the education is what is very, very important,
Mm-hmm.
because once a young person is very knowledgeable about this,
Mm-hmm.
it will be very helpful for them to make an informed decision.
Mm-hmm.
So, if we want to get to know more about this health, sexual reproductive health,
Mm-hmm.
the information and accessibility to whatever that in regards to sexual health,
Mm-hmm.
you can go to the nearest clinic, any government clinic. The service is free. There are youth friendly corners where you can find fellow young people who understands you at your level, and without being judgmental. Even when you come, they'll attend to you and give you more information.
Mm-hmm.
Apart from that, even the nurses that are there, even if they are old, they are trained,
Mm-hmm.
to just hear you out, and you'll be able to express yourself, ask questions, and they'll be able to give you answers accordingly.
I think even parents should play a role in that. They should consider talking about, sex with their children at a young age as something that's normal. Because twalesambira pali sex mu grade 4. Now imagine kuskulu na bakweba and then mambo basa mukubepa
It's true.
mukubepa
It's true.
yeah.
Yeah. I think that's why we're even having these other things that are erupting, because children don't really understand.
Mm-hmm.
What they see out there is what they believe.
Mm-hmm.
So as parents, we should have this time with our children, sit them down, whether a boy, whether a girl. We should tell them on the importance of, sex.
Mm-hmm.
Why is sex there? At what point should one engage into the sexual activities? Why should children refrain from sex?
Mm-hmm.
Everything. I know it's a topic that is very uncomfortable to discuss, especially with a child, especially the one of the opposite sex, maybe a mother talking to a boy or a father talking to a girl. But it's very, very important, because socialization begins in a home, and the first people that you come in contact with are your parents. It's like the world that one walks in is painted by the parents, how they eat, and sometimes they just look at you and they'll be behaving like you. So sometimes, even when you verbalize, what is important is learn from what they've already known. Like for someone who's in grade 3, like you put it, ask them, what have you learned? What is sex? Others will go as simple as just saying it's male and female. They'll define it by gender. Then it's up to you to see how the child is able to grasp it, and keep adding to that child, so that when that child encounters something different, they'll be able to run back to you and also inquire, than going to their best friend Chanda, who has little knowledge and who at the end of the day mislead them. Yeah.
Well, thank you so much, ma'am, for finding time. I know it's a comfortable, few people, especially elder people, feel comfortable to talk about, the sexual reproductive health of young people. Maybe just in one sentence, yeah, to our viewers.
What can I talk about? Yeah. So sex in itself, it's a beautiful thing.
Mm-hmm.
But when you engage in it at a very tender age, it has got consequences.
Mm-hmm.
So you really need to think about these consequences as young people. Don't just rush. Know why you want to engage into this sexual acts. Like we said in the earlier, you talked about something that you've already engaged in. It's difficult to come out. But I believe even if you've started already, there's still room for change and improvement, until when you feel this is the right time for me to engage in sexual activities. Yeah.
But to our viewers, we were talking about the sexual reproductive health of young people, and I had Madam Judith Mutanka who helped me, gave me some information and education. Hopefully that you have picked one or two things that is going to help you. Yes, my name is Enek Drums, and this is where we close off with today's episode. Till next time, for now, it's bye-bye.